Dr. Crockett and Dr. Sanders here from Zeal Integrated Health, and today we're going to talk about tech neck. This is something that we're seeing develop just because of COVID-19, and people are working from home, I think, a lot more. They're on their laptops, they're sitting in bed, they're sitting on their couch, maybe they're sitting at their kitchen table, but their posture doesn't really work well in that environment, and so they just keep bending forward, or they're on their phones and their head starts moving forward, the upper body starts to round forward, and we're seeing a lot of muscles start changing over this 5-month, 6-month period of posture, and we're seeing this come into the office. Dr. Sanders, what do we do? What do we recommend at home, and how do we approach it in the office?
Well, the first thing we want to do is prevention. There's many things to do after the fact that we handle here, but the first thing you want to do is fix your posture and how you're sitting. Most people think that sitting upright will give you less crane in the neck and in the shoulders. But what professionals actually tell us, and what we tell our patients, is to take on more of a reclined position. Not very many degrees, just a few, about 20 degrees reclined, and that sets your head over your body mass, which gives you less stress on the neck. An exercise that we have most of our patients do is called chin retractions. Chin retractions entail taking your chin and sucking it back, just like so, repetitively. What that does is it forces the curvature of your neck back over your shoulders where it should be, and counteracts all the stress from leaning forward or looking down.
That's something you can do like a 3 or 4 second hold when you're doing that. And if you notice, like a lot of times if you're doing it, I always tell my patients that you're probably going to develop a double chin, like, while you're doing it. It won't actually stay there, but it's something that can actually like look like a double chin if you're doing it in the mirror and observing it yourself at home. So we want to demonstrate one of the techniques that we use here in the clinic using our Pro Adjuster. We have a protocol that we can use on tech's neck and people that have rounded posture. So we're going to show you that next. So this is our Pro Adjuster 360, and we're going to use a technique to work on the posture in the upper back, and it affects the neck. And so we're going to come in and demonstrate this on the top here. I'm going to have our patient just turn her hands out like that. She's going to look up at the ceiling, and then we're going to let this run. It's going to sound, you're going to hear that ratcheting sound. It's impulses that it's pushing through the spine to work on the posture. And so we're going to let that run. It's going to run 100 impacts, and then we're going to move down through the curvature in the back. And so this is very gentle, but using high-speed impulses, we can start to affect that curvature and just keep trying to bend the back right where those are impulsing. So try to bend right where my hand is. Keep bending up. And we're just going to do one more here. And so by letting that run through there, you can go ahead and relax. It's going to help bring the posture up and get the neck back over the shoulders like we would expect the normal posture to be. So we can offset some of this technology and what it's doing to you at home.